This setup is the prone Hypothenar spinous push, L1 to L5. Indications are rotation and lateral flexion restrictions or malpositions. Starting out, I want to have my headpiece slightly down, my thoracic piece slightly down as well to create some extension and pretension in the lumbar spine. I want my AS-ISs of the patient to be at the top of the pelvic pad, and the pad of our foot piece will be supporting the lower extremities at the ankles. Once I've got that taken care of, then I will get into position, and I'll either use a modified fencer stance or a square stance. And for this demonstration, I'm going to be in a square stance. Now, based on the segment that you are contacting, that will determine which hand you are going to use as a contact hand. I'm going to use my superior hand for L1 and 2. I'm going to use my inferior hand for L4 and 5. And at L3, it could be either hand, whichever feels most comfortable to you. Now, once I find the segment that I'm going to make my contact on, I'm going to take a tissue pull. That tissue pull is going to be P to A, lateral to medial, with some torque. If I'm contacting the right side of the spinous, it's going to be a clockwise torque. If I'm contacting the left side of the spinous, it's going to be a counterclockwise torque. So I'm going to use L3, and I'm going to use my superior hand because that's the one I'm most comfortable with. And I'm going to take a tissue pull, P to A, lateral medial, with clockwise torque. So I'm going to slide right in on that spinous, and when I do, I'm going to take just a little bit of a clockwise torque. Then I'm going to stabilize using my indifferent hand to wrap my wrist. Bring my body over my contact, and then my line of drive, once I have gotten the patient to pretension, is going to be P to A, S to I, lateral to medial. And of course, just a thrust there. My force generator is arms, trunk, and body. And that is the prone Hypothenar spinous push.